Hi, everybody. Welcome to Medpsych Health. Thank you for joining us. I am very pleased to have with me today Dr. Polack from Progressive Pediatrics. Dr. Polack is going to be joining us for one of our insightful interview series. So I am very pleased to have her. I have recorded videos with her before, so we are very excited to have her again with us. So Dr. Polack, I'm going to let you kind of start by giving us some of your background and what you do and telling us a little bit about yourself.
All right, well, I'm Noha Polack. I'm a pediatrician. I've been practicing in Hudson County, New Jersey for the last 24 years. Same place. So
Wow.
yes, I built a big community around me and that I absolutely enjoy. So many of the kids that I saw as children are now parents and they bring their children to see me. It's my joy. So to be perfectly honest, this pandemic shook the ground under all our feet, myself included. And I felt unmoored because suddenly my patients weren't coming. I felt disconnected, not only from my parents and people around me, like I can't go with my friends, but suddenly my patients weren't coming and were not calling. And again, this community that was around me suddenly gone. So on a personal and on a professional level, it strikes hard. And so I started to do more and more of these videos and I felt more connected just talking to them. And then they started responding and I felt so much better. So things started to improve a bit just because I took that, that first step. Okay, I'm going to make these videos and see what happens. And then people started to chat, whether it's on Facebook or, call and have conversations. And I opened the door to all of their anxieties, letting them know, hey, I'm having these same anxieties. I am not any different.
And I think I think that's huge for parents to hear that, right? The physician on the other side is just a human and also a mom or a dad and a parent too. So I think that's good that you do that.
Exactly. So anyway, so I put out a lot of information to come either via televisit, virtual visits or in person to have discussions. So at my office, we're seeing kids who are not sick. So the kids that are welcome in and we sit and we have conversations, mostly with parents, sometimes the teenagers. Most of the teenagers want to do virtual visits with us.
Yes.
And we do that, to be honest, a lot. And the most distressing thing that people are dealing with now is fear. So in Hudson County, especially, we're very close to New York City. As a matter of fact, my office looks right onto the Empire State Building. So I can see where everything is. And we do have a lot of COVID-19 in the community. So these kids, teenagers included, are truly afraid of dying, Dr. Hanna.
Wow.
They are.
Wow.
They express it very clearly. I'm afraid I'm going to die. And we have to have conversations. And oftentimes they do get the disease, the COVID-19. And they recover and survive. And even after the recovery, they're like, well, what if it comes back? So those fears are huge that we're dealing with. In addition to the discussions you and I just had about disappointments, about missing major life events, missing trips. Oh, I had, this was my summer to go to this place or that place. I can't go anymore. So I would say that fear of dying and disappointment are the biggest things I'm dealing with mental health-wise in our practice.
It's extremely sobering to hear kids and fear of dying, right? We don't associate children and as a pediatrician who's taking care of kids, generally I'm, totally different world than, some, internists or cardiologists or, geriatricians and to hear your patients say that must be really, sobering to hear 16-year-olds and 18-year-olds worried about dying, right? And
Absolutely.
they're not, and very few, any of us when we were at that age were in any way ready to have those types of conversations. So.
Absolutely. I feel like they're maturing right before my eyes in the last 2 or 3 months. I can't believe the level of anxiety they're dealing with. And to be honest, a lot of them are stepping up to the plate, maturing and giving back to the community in certain ways. And I'm proud of a lot of them. But that's what we're dealing with. And question is how...
Yeah. What do you, what are you telling your patients? What are your recommendations to parents and kind of, kids or teens who are tuning in? What do you say?
So to be honest, thank goodness we do have access to mental health professionals. And I do ask specific questions about whether they're afraid of dying, or if they're trying, if they've tried to hurt themselves in any way. And if they give me that clue that they've tried to hurt themselves, then I go straight to, emergency care, not in emergency rooms at this point, but through other sources. But I do talk to them a lot about, is their anxiety warranted? Is this a real fear? Is what you're feeling a real fear? Is there a lion right next to you, or is this an imaginary lion that's standing next to you? Can you tell the difference between true fear and anxiety of something that may or may not happen, and what are the chances of them actually, dying of COVID-19, which is, thank goodness, relatively low in young, healthy people.
Right.
So I try to deal with fear versus, anxiety. Is it a warranted thing? And to be honest, a lot of the times I refer to people like yourself.
Yeah, no, and I think, and every kid is different, right? Children who are prone to anxiety, right, who already have that vulnerability are more likely, of course, to experience anxiety in this situation. But one of the unique things probably, and I think maybe you're alluding to this, is we're in such a unique situation right now where kids who are not typically anxious are experiencing anxiety.
Exactly.
Right? Kids who are not typically prone to depression are experiencing depression because it is such a unique circumstance. So, well, that's great. Thank you for joining us and sharing some of your insights. I know that this has been a unique time for all of us in practice and seeing patients. So hopefully these videos are helpful. We're all in the same boat as you who are watching. I have kids. I know Dr. Polack has kids, and we're trying to parent through this too. So with not necessarily, we're not trying to provide easy answers. We don't think they exist. Life is much more complicated than that. And certainly this situation has shown us that. So, well, thank you everybody for joining us, and see you at our next video.
Have a good day.